Happy Nursing Week, everybody. This is Nursing Week 2018, and from us at RPNAO, we just wanted to join in your celebrations and let you know how much we recognize what you do and let you know a little bit about what we're up to here. In the past number of years, RPNAO has become recognized as leading experts in role clarity, particularly of the practical nursing role. We've been recognized throughout Ontario, but also across Canada and internationally. In fact, during Nursing Week this year, I will be in New Zealand providing an opening keynote to a conference of practical nurses in New Zealand to talk about some of the ways that we're doing work to better describe the role and grow an understanding of the role. We've done a really great job here of that work, but we know that the work is not done. Recently, in the past year, we carried out a road trip where we talked to hundreds of practical nurses in Ontario. Because we're a very member-focused organization, we see our role as doing what our RPNs tell us is most necessary to be done. And what RPNs told us is there is still quite a gap between the reality of their role and the understanding of their role. So more work to do. They also told us that they're not there yet in terms of being respected for their contribution to the healthcare team. So what we've done in response to that is something that I think is going to be pretty exciting. We have contacted our colleagues at the Nurse Practitioners Association, and we have contacted our colleagues that are with the Ontario group of the Canadian Nurses Association, and we have suggested to them that what might be a really great opportunity is for the three groups to get together to talk about our roles and to share where our roles are similar, where our roles differ and how they differ, because all three groups are different from each other, where they overlap, how best to work together, but most importantly, we're looking forward to modeling the level of respect that is needed in Ontario these days when we look at all categories of nurse. We want to model for you what it looks like when every category understands and respects the contribution of another, and I think you'll see that. To do this with you, we are going to have a Facebook Live panel. The date has not been announced yet, but you can watch our Facebook and our website for the announcement. We'll let you know well ahead of time when it will be, but it will be at the end of May. And we'll be having a conversation where we take your questions and your suggestions for topics that you want to hear us talk about, and the three groups will talk about those. You can submit your questions to us ahead of time. You can send them in a private message on Facebook. You can send us an email. We'd love to know ahead of time, but there'll also be some opportunity during the event to spontaneously ask a question or make a comment. And we're calling our event Stronger Together because that's how we see the nursing profession. We'd like to join with our other categories, be better understood, and be stronger together. And we think we're going to start steps towards a better understanding. In the future, after this initial event, we'll be taking on, with our friends and the other groups, we'll be taking on issues that are identified as being things that need to be solved in the healthcare system in terms of nursing, and working on those issues together in a collaborative fashion as nursing should work. So that's what we're up to. That's what we're doing in the area of role clarity, the thing that you told us was most important to us, to you, to have us working on. And we want to do this with you, so we look forward to having you join with us. And in closing, I just want to say that there isn't a day goes by at RPNAO that we don't recognize how hard you're working, how much more difficult the working environment is today than it used to be. And there's not a day goes by that we don't advocate for you by sharing those stories that you tell us with the government or other organizations, and work to help you solve some of those issues. So thank you for being connected with us. Thank you for directing our work. And thank you for making a difference in the lives of the people that you care for. We deeply appreciate that as nurses, as patients, as family members of patients. Thank you so much.